Okay, we're going to get started. I want to introduce our speaker. Dr. Ellen Wiedner graduated from Princeton University with a degree in biology. She received her veterinary degree from the University of Pennsylvania, then completed an internship in ambulatory and production medicine at Cornell University, and a residency in internal medicine at Purdue University. She's one of very few veterinarians to be a diplomat of both the American College of Veterinary Internal Medicine and the American College of Zoo Medicine.
I don't know what to do.
After a stint in equine practice, she made an abrupt U-turn into elephant medicine when the opportunity arose to work with the largest herd of Asian elephants in the Western Hemisphere. For the past 5 years, she has taught the veterinary section of the Principles of Elephant Management course for the AZA and has been a consultant for the Veterinary Information Network on their ruminant and equine boards. She has worked at a number of zoos and currently consults nationally and internationally on elephants, rhinoceros, and endangered hoofstock. I also have to add that at Princeton, Ellen was my sister's roommate in college. I have known Ellen since I was 15 years old. Ellen is like a part of my family, and I am so excited to have her here because Ellen is one of the funniest people I know, the smartest and the kindest. So please help me welcome Ellen to our Morris Bart lecture.
Hey folks, thank you so much for taking time out of your day, and I love talking about elephants. It is so nice to see Rachel's face. As she said, we've known each other for many decades. I don't even want to think about how long we've known each other. And this is the first time I think that I've ever spoken about elephants in front of my friends. Usually I give lots of lectures about very large animals, but they're to people who work in the business or, you know, would like to get into the business. So for me, this is actually really a little different and kind of exciting. And one of the other really interesting things that I discovered when I woke up this morning is, by coincidence, today is National Elephant Appreciation Day. I didn't even know there was such a holiday, but my email is filled with notices because I am on a lot of very strange mailing lists. So happy National Elephant Appreciation Day. And I'm going to talk to you a little bit about elephants, which are just remarkable creatures. And I've been very lucky to spend the past 2 decades taking care of them. Okay, so I am actually a zoo veterinarian. I take care of anything from octopuses to zebras to tigers to bears to, you know, rare mice. And one of the questions people often ask is, how do you learn all those animals? And the truth of the matter is you don't learn all those animals. You learn a couple of animals really, really well, and then you extrapolate. And that actually works really well. There's this motto, one medicine, many species. You'll see it you know, on brochures from vet schools, and it's the big way of thinking. And actually it works pretty well. The 5 species that they teach you in vet school are the cat, the dog, the chicken, the horse, and the cow. And you don't get elephant medicine in vet school. So the reason this works so well is that many species kind of have a basic plan, an anatomical plan, physiology, and then you can do pretty well by taking what you know about one species and applying it to another. So if you learned about the domestic cat, you can actually take care of otters like this guy in this corner because they're very similar. Obviously big cats are just like little cats. This is a tiger, this is a little lion, and they really get a lot of the same diseases. They have a lot of the same health needs and health issues. And you just learn sort of the specifics, but it's not a whole brand new thing to go from a little red pussycat to a big tiger. Dogs, if you know dogs, you can do wild dogs like wolves or jackals or foxes, but dogs and pigs including this is a warthog, they're kind of a very similar body plan. Bears are a lot like dogs. So if you know a dog, you're pretty good taking care of a bear. And marine mammals, seals, walruses, what we call pinnipeds, they too are a lot like dogs. So a lot of the medicine is the same. They get distemper just like dogs do. We vaccinate them like dogs. Obviously, they're in the water and we have to think about that. That's a big difference. But ultimately, it's a similar body plan. And we can kind of go through this. This is a horse. Horses are, if you know how to take care of a horse, you learned it in vet school, you can do zebras, which you see here on the top. You can do tapirs. They're actually very closely related to horses, and believe it or not, so are rhinoceroses. This guy weighs 7,000 pounds, this guy weighs 1,000 pounds, so that's a difference, but they're not that different. And finally, our cows. Cows are creatures with multiple stomachs, and we call them ruminants. And so if you can do a cow, if you know cow medicine, you can take care of exotic hoofstock, wild goats and antelopes, giraffes, they're long-necked cows, really. And look at those teeth. This is a mouse deer, and they have these amazing teeth, but it's just kind of a little tiny cow with pointy teeth. And then you get to chickens. Chickens let you know your way around a California condor. I took care of them in Los Angeles. And we know that reptiles and birds are very closely related. So that right there, that's similar medicine. And, you know, when they bring back the dinosaurs, which they keep telling us, you know, I probably watched too many sci-fi movies late at night, that one day we'll be able to find the DNA and bring back Jurassic Park. Well, I'll be good for their medicine because I know how to take care of chickens. So really, you know, I'm very prepared to be a zoo veterinarian. Where this all falls apart is with elephants. Elephants don't fit any pattern out there. They're not a giant horse. They're not a giant cow. They're their own thing. This photograph, by the way, which I think is very cute, is a friend of mine who has a lot of elephants in Thailand. The mahouts just kind of board their elephants at her place. And everybody was upset because one of the Thai zoos had brought pandas from China. And so the pandas were all the big news, and they were getting lots of newspaper attention, and they were on TV. And the mahouts wanted their elephants to get on TV and a lot of attention. So this is how they did it. I think it's a very fun picture because they look so silly. The other thing about elephants is that they're really complicated animals in a lot of ways. This is the largest land animal. There's a lot of politics involved in elephants, which I'll touch on briefly. They're endangered. They often live in the wild in areas that are experiencing warfare. So it's hard to know what's going on with wild elephant populations. And it is difficult often to know the right thing to do with them because they're so big that things that we take for granted, like using a stethoscope, which I use on any other patient, I can't hear anything with a stethoscope on an animal that's bigger than 3,000 pounds. So we often have to do very strange techniques and make up techniques to do medicine that we take for granted in other species. They really are unique. And the other thing about them is they're very beloved, whether you are from Asia or from the Western Hemisphere, you know what an elephant is. Everybody has grown up with elephants, whether it was Babar or Horton, Here's a Who, or Snuffleupagus from Sesame Street, or whether you're a Buddhist or whether you're from India and you worship the god Ganesh. We are all familiar with elephants. And so they're very, very entrenched in our consciousness and our mind. And we think we know elephants and we want to know elephants, but we often don't. And I always love Halloween costumes that look like elephants. They're very silly. But you know, sometimes what we think we know about elephants are as much like elephants as these little cats and dogs in their Halloween costumes are. The things that make elephants unique, I think there's two areas you can look at. And one is that this is an ancient species. Elephants are not a branch off of somebody's evolutionary tree. This is an animal that appeared on the planet 55 million years ago. And when Mother Nature has 55 million years, she can come up with some really strange stuff. And this is what they tell us the earliest elephant looked like. It doesn't even look like an elephant. It looks kind of like a tapir or a pig. It's about the size of a Labrador retriever. And the first elephants appeared in Africa. They were aquatic. They lived by the water. And give me 1 second. Okay. Yeah, they lived by the water. And, you know, the things that we take for granted as being elephants, the great size, the tusks, the trunk, these are things that evolved over 55 million years. And during that time, elephants left Africa. They moved into all the continents, into Europe. They did not get into Australia, but they moved into the United States, North America, South America. Elephants really went all over the place. And the family tree of elephants is enormous. These are some of the big guys. These are some of the animals that, you know, some of us know, mastodons and mammoths, but the elephant family tree is huge. And some of them, it's kind of hard to tell that they're really elephants. But today, all we have left are two species. We have Asian elephants, Elephas maximus, and we have African elephants, Loxodonta africana. We know that mastodons are most closely related to the Africans and mammoths to the Asian elephants, but this is all we have left. And there's a lot of argument about whether there's a forest elephant or a savanna elephant, but basically we have Africans and Asians. That's all that's left of this enormous family tree. And in Europe, we continue to find new fossils. It always amazes me that somebody's found a brand new elephant species somewhere in Europe. We've even found pygmy elephants. They don't look like this. I love that photograph. It's completely phony and photoshopped, but there are pygmy elephants that are about 6 feet tall, and we have those fossils, and they probably survived until maybe 10,000 years ago. So some of these ancient elephants, you know, they're not that ancient. Can you guys hear me okay, by the way? Are you guys?
Yes.
Okay,
Yeah.
Good.
And just so you know, if you have any comments that you want to interject or questions while Ellen is going, feel free to use the chat button, or you can unmute yourself and call out your question, but otherwise we'll save time at the end for questions.
Yep. All right, so, and you know, some of this ancient history we can see in the fossil record, and we can follow it to modern times. The teeth of elephants are like no other. These tusks, these beautiful tusks, those are incisor teeth. Now that's remarkable because there are a lot of species that have pointy teeth, canines, tigers, baboons, vampires, but they're canines, right? These are incisors. These are the front teeth that are so modified that they've become very long, unusual teeth. The only other animal that has long extended incisors are narwhals. That's the unicorn of the sea, and that's just, we call that convergent evolution. It just happened by itself. They're not relatives of elephants. But even the molars are kind of crazy. These teeth they have 6 sets of teeth in their life, and they only have 4 teeth in their mouth at any time. And at birth, the teeth are sitting behind the jaw bones, and during the animal's life, they move forward as if on a conveyor belt, and they start joining together into massive blocks, and a final molar will weigh about 10 pounds, and then they keep moving forward and another set comes in. And there is no other species that has teeth like that. We can see that occurring in the 55 million year fossil record. There's things that we suspect are ancient, but we can't prove because we don't have fossil remains. And elephants do lots of weird things. Must is this period of hyper-aggression and hypersexuality in male elephants, both Africans and Asians. Elephants have these unique glands. They're called temporal glands. And in a healthy elephant, about every month, these glands will enlarge on either side of their head and start secreting these very odd chemicals. And this is a form of language. This is chemical communication. Depending on what chemicals they're excreting, they're sending messages to female elephants. I'm here to breed. They're sending messages to other male elephants. This is my territory, don't come into it. And these chemicals will continue to increase. They will be excreted from the sweat glands on their feet. They will be released in urine. And this is, people have looked at these molecules. They're unbelievably complicated and they're very, very meaningful. Other elephants know what those means. And when you think about language, which requires a way to communicate it, a way to understand it, a way to disperse it, you realize that didn't occur overnight. This is an ancient, ancient thing that occurred over millions of years. And it's really quite fascinating. The other thing that I think goes into making elephants unique is their massive size. And you don't have to really ponder very long to realize that if you are 12 feet tall, you weigh 18,000 pounds, some aspects of your physiology are going to have to be different to support that kind of weight. A big male African elephant is 18 to 20,000 pounds. Those tusks on a big tusker elephant are 200 pounds. You know, your head has to support a lot of weight. Even a small elephant, though, a young female Asian elephant is 6,000 to 7,000 pounds, maybe even 8,000 to 9,000 pounds full grown, depending on what part of Southeast Asia she's from. So physiology has to change to support that. And this is often where, as a veterinarian, I am encountering things that don't make a lot of sense and make it very difficult to take care of elephants. And I'm dealing with physics, basically, in ways that are kind of crazy. One of the things that I had noticed, when animals die, we do autopsies on them to find causes of death. And I could never find bone marrow in the elephants. This is a femur of an elephant that I had cut open because I was determined to find bone marrow. You know, this animal, bone marrow is where the body produces blood, and elephants have a lot of blood in them. It had to be coming from somewhere. And so at necropsy after necropsy, I would start cutting bones apart. I went looking in the scientific records. Nobody had reported where the bone marrow was. And I finally found the bone marrow. Here it is. It's in the vertebral column of the spine. Why is it there? Well, because if you weigh 10,000 to 20,000 pounds, you can't have anything hollow in your legs. You need columnar support. So these leg bones are absolutely just full of bone. There's no marrow in there. But on the top, in the spine, you can have bone marrow because that area doesn't have to support the massive weight. So that's pretty unusual.
Interesting.
And like I said, elephants have a lot of blood. Well, they have about 100 gallons in a full-grown elephant. And let's think about how you move blood around a body. Well, they have all sorts of strange adaptations, ranging from pumps in their feet to push the blood back up toward the heart. They have valves in their vessels. And that's what I'm trying to show in this picture. It's kind of hard, but you know how your heart has valves and they close tightly to prevent blood from going in the wrong direction? They have valves that close as tightly as you can imagine. And the reason this was so interesting to actually dissect out is one of the things that's amazing is when you draw blood from elephants, and we regularly draw blood, you know, we're measuring how healthy they are, just like if you go to the doctor and you get your blood drawn. Very often you'll see a beautiful vein and you'll put your needle in it and you won't get any blood. I mean, this is a vein the size of a garden hose. It's bizarre that you can't get blood out of it. Well, you know why? Because you hit a valve, and you're hitting a valve with the tip of your needle causes it to contract. This is a great thing. If you're out in the wild and you have a vein the size of a garden hose and you nick it, you're not going to bleed to death because that vessel is going to close up. But if you're a veterinarian and you're supposed to get a tiny little red top of blood and you're just hitting valves, that's a little bit annoying. I tell people who are learning how to take care of elephants is that don't get frustrated, just take your needle, put a new needle onto your syringe and go about a ½ inch away from where you inserted your needle, and that way you're avoiding the valve and you shouldn't have any problem. Elephants also have these bizarre, we call them anastomoses, which are a joining of veins and arteries all over the body. And these are ways that they are managing to move this blood efficiently. But there's a lot of stuff we don't understand. One of the oddest things about elephants is that they can have a dead fetus in the uterus for years. That baby doesn't die, the elephant doesn't get sick. And that's a good thing because we can't do C-sections on elephants who are having trouble. We used to try to get the elephant babies out because if you had a dead baby in your uterus, you would not survive. We now know that we leave them for somehow these elephants are able to create a shunt around that uterus where no toxins get out, nothing goes south. It doesn't rot. And for whatever reason, years later, they may kick that baby out and that baby looks preserved. I've now seen a couple of these. It is the oddest and most peculiar thing. And at this point, I can't explain it other than to say that we've learned you don't do a C-section on an elephant. You let that elephant figure out when it's going to actually deliver it. We continue to learn, this is a study that I did with some colleagues, that there's more and more things that are bizarre about elephants. I had discovered when I started doing elephants that there were no normal values published for urine. You know, collecting urine is one of the things that, just like in humans, it's standard. You go to the doctor, you give a urine specimen. Our patients go to the doctor, cat, dog, we bring a urine specimen. Well, there was no normal results for ever published for elephants. And I thought, aha, I'm taking care of 60 elephants. I'm going to just collect their urine and I'm going to I'm going to figure out what normal is. And then I kept coming up with results that were so bizarre, I didn't know what to do. And so I did what a lot of veterinarians do, is I blamed the laboratory. You've messed up. These values don't make any sense. They're not compatible with life. And I found another laboratory and they came out with the same stuff. And so I was just very grumpy about the whole thing. And so I borrowed the equipment and ran it myself. The laboratories weren't making mistakes. Elephants are just bizarre. And what we discovered is that the serum osmolarity and the urine osmolarity, which is a measure of how many particles are in there to keep blood in blood vessels, to keep urine in a bladder, were so much lower than any other species that we'd never seen anything like it. My guess as to why it's like this has to do with hydraulics. How do you move that blood up a giant column? It's almost like a chemical plant. And I keep thinking that I need to talk to somebody who designs chemical plants, because if you're going to move stuff up a really tall column, like a blood vessel that goes from a foot to a head, you can't have heavy stuff in there. That's my guess. But in any event, what we've now noticed is that it's going to, this finding changed how we give fluids. And if you've ever been to a hospital, you might have an IV and an IV pole, and there's fluids going into you. And we do this in veterinary medicine. This is a little puppy, he's getting fluids IV. We don't do it that way in elephants. Okay, so this is an elephant getting fluids. And yes, there is a man who is up to his armpit in the elephant's rectum with a hose, with a garden hose. This is in Sumatra. This is my friend, Dr. Christopher Stremme. And we are giving a sick elephant fluids. Now, you can't stick a garden hose up anybody's butt and think that's good medicine, but it works in elephants because their serum osmolarity is so low that the stuff that comes in those nice little fluid bags actually isn't good for them. It's we call it hypertonic. It's got too much saline, too much pressure. It's gonna kill the elephant. We give our fluids this way and it works very, very well. It rehydrates elephants. They don't seem to care very much. And their colon is remarkably absorptive. We even give medicine this way. Yeah, there's no other species we do this with, but we're very lucky because a lot of elephants do not, they have very, very particular tastes. And elephants can be very difficult to convince to swallow medicine. And I've actually had medicine thrown at my head by an elephant who was not liking what I was trying to give her. And sometimes we try and hide the medication in a yummy something or other, in a piece of bread or whatever. They'll just take it and wing it at you. And so I'm happy not to have bread thrown at my head. And this works very well. But there's so many things about them. Their blood cells are different, and many of their body organs, their organs are like nothing else. You know, we talked a little bit about my urine study, which was so bizarre. It took me like 9 years to publish it to try and make sense of the results. But that study, which finally got published, we found that adult elephants don't dilute their urine, don't concentrate their urine very much. I'm going to guess that probably is a reflection of their aquatic heritage. You know, fish don't concentrate their urine because they don't need to. They live in water, and adult elephants don't either. And these are all urine samples from different elephants. They're all normal, all normal. Look at the difference in color. I mean, that's kind of odd too. But we're dealing with kidneys that are very strange, and these kidneys don't look like our kidneys. They look like lots of tiny kidneys stuck on top of each other. They actually look a little bit like fish kidneys, again, indicative of their aquatic background. It's important to know this, though, as a veterinarian, because they get a lot of kidney disease, and these are all cases I dealt with. This one is an elephant who was born, so it's a congenital problem, with one very abnormal kidney. The right kidney was shrunken, and the left kidney, for reasons that I don't entirely understand, became obstructed. And this is the ureter that connects the kidney from the bladder, and you can see it's highly dilated. And she developed very, very severe hypertension, which is high blood pressure from this. And ultimately, she did not live a long life, but this is a congenital abnormality. That is uncommon, but what is very common are kidney stones. And this is a bladder stone. That's a 10-pound bladder stone. You don't want a 10-pound bladder stone. And this elephant really struggled with this. But these are bladder stones from elephants that were actually passed. This was not passed. This elephant did not survive. But kidney and bladder stones are also common in these animals. So knowing about these bizarre kidneys has become very, very important in taking good care of them. This is an elephant liver. This is one of the autopsies I'm talking about. It's a big liver. It weighs about 20 pounds. I'm going to ask you guys not to take pictures of the screen, okay? Because nobody really wants pictures of dead elephant livers, unless you're me. The reason it's important to know about elephants' livers, and they are weird in a lot of ways, and I'll talk about that in a second, is because they get a lot of liver disease. This is an elephant who died of other causes, but she had all these bouts of belly pain. We call it colic. And what she had were gallstones. elephants don't have a gallbladder either. And that's not unusual. Horses don't have gallbladders, but if you get gallstones and you don't have a gallbladder, they just wedge themselves in the liver and they can become very uncomfortable. What I was going to say about, I think I have it later on, so I'll get back to livers later. Hearts, elephant hearts. So this is how, like I said earlier, you can't put a stethoscope on an adult elephant. You can't hear anything. So how do you know if your elephant has a healthy heart? Well, you jerry-rig an EKG together. So the little alligator clips, they won't stick to elephant skin. It's, you know, anywhere from a ½ inch to an inch thick. So what we did was we went to an automotive store. That's where I actually buy a lot of my elephant supplies. And we bought these very nice clamps and we hooked up some metal to it and we put a little thing so we could hook it up to the EKG machine. And then we attached those to the elephant and we got this beautiful EKG. Well, it's beautiful, except it's weird. It's very weird. This is a perfectly healthy elephant and she's got U waves. Now, if you know anything about hearts, you've probably seen the PQRS T waves, you know, but U waves, what are those? I didn't even know what they were. I'd never seen them before. Well, U waves turn out to be something that are seen in sick humans with rare diseases. We saw these in normal elephants. Our cardiologist thinks it might have to do with the fact that the heart weighs somewhere between 40 and 50 pounds and is, you know, dealing with 100 gallons of blood going through it, and it may be jiggling a little bit. And that jiggle shows up on an EKG as a U wave, but we don't know. This is part of elephant mysteries, elephant mystery medicine. But the thing is that elephants get a ton of heart disease, including wild elephants. If you do an autopsy on a wild elephant, especially the African elephants, you often find atherosclerosis and atherosclerotic lesions. We don't know why. This is on the right, this is a normal heart. This is a 45-pound heart. On the left, this is an elephant that died of a disease that causes a lot of hemorrhage, and it's the heart that typically gets affected. So it's important for us to know about hearts. And this is one of the great challenges of elephant medicine. And, you know, we can go through almost every body part of the elephant, you know, eyes. So this is an elephant who has what appear to be 10-inch long eyelashes. She's a lovely old elephant. But the people who study anatomy actually tell me these aren't really eyelashes. The definition of eyelashes is that they're on the edge of your eyelid. These are not on the edge of the eyelid. So I don't know, eyelash-like is what I call them, but they can be very, very long. That's absolutely normal, but it's not an eyelash. They don't have tear ducts. So they do produce tears, but because they don't have ducts, the tears are constantly coming out. And the reason that's important is sometimes you see elephants that look like this. And people who are animal activists and anti-zoo will tell you that the elephant is crying. The elephant isn't crying. They are always draining tears. And on some elephants, depending on their skin and what color it is and whether they're wet because they've been throwing stuff on them, sometimes you can see it very clearly. And it does look like tears running down their face, but this is a normal elephant. And even more crazy is some of the elephants, and for me, I've only seen it in younger Asian elephants, they have a detergent in their tears. So they're frothing. Their tears are frothing. You can see this foam. It's normal. I don't know why they have detergent in their tears, but they do. It's important to know what's normal in an elephant because they get a lot of ocular disease. This is an elephant who had we call it a stromal abscess. It's an abscess, it's an irritation to the cornea that instead of becoming an ouchy thing you see on the outside, it actually goes in. This is something humans get, anybody can get it. And what you can actually see here, this white thing, is some pus inside the eye. And that's a medical emergency. If you don't deal with that right away, and somebody can go blind. This is an elephant. This is something that's kind of weird about old elephants is they get calcium deposits. That's what those white dots are. This is also an elephant who has a little bit of a cataract forming. Elephants can be treated for cataracts. And we actually have a medication, it's just topical, that we can use to dissolve these calcium deposits, which will impede vision. They're not serious, but you know, it's better to be able to see than not see. Here's a full-blown cataract right here. And this, I think this elephant, they decided not to do surgery, but we can do surgery on cataracts and restore vision in them. So knowing what's normal and what's not normal really is important. Elephants, many people don't know, are fantastic swimmers. They love to swim. And they can swim long distances. And one of the cool things they do is they snorkel. This is one of the elephants I've taken care of over the years. This is Billy in his pool. Billy is a massive, massive Asian elephant, and he's snorkeling. Well, we think that this thing that they love to do explains another really odd aspect of elephants. And not that they are the Loch Ness Monster. I saw that in a newspaper and I thought that was just awesome. But what it is that their lungs, so most lungs, your lungs, my lungs, cat, dog, horse, cow, are covered in these, it's almost like saran wrap, and we call it pleura. The pleura cover the lungs, and you may have heard of pleurisy or pleuritis. These are when they get irritated. Elephants don't have that. They have this thick, fibrous stuff that actually connects to the ribs, and it looks so bizarre. It looks like a white sheet over the lungs. And somebody who studied elephants and also knew a lot of physics finally calculated the water pressure difference between the top of an elephant, where the trunk is, where he's bringing in the air, and elephants breathe through their trunks, not through their mouths, and where the lungs are. And he realized that if you had those tiny, delicate tissues of pleura around the lungs, there's a good chance that because elephants are so big, and the pressure difference between the top of the trunk and where the lungs are and the weight of the water would actually damage delicate pleura like any other species has. And so many of the deep diving animals, well, they don't try and breathe, but they have adaptations around the lungs to deal with the pressures. And the suspicion is that this weird fibrotic tissue around the lungs is another adaptation to help them breathe while they snorkel across lakes. The feet are crazy complicated. I love this photo because we think of elephants just with these big cylindrical feet, but inside, this elephant is walking on stilettos. This is an incredibly complicated structure. This thing down here is the digital cushion, and this is a pump that pushes blood up to the heart. It's also something that deals with the forces, the incredible forces of 20,000 pounds of elephant hitting the ground. And an elephant's foot hitting the ground expands 10% in diameter with every step. So that's an incredibly complicated issue, and elephants get a lot of foot problems. So these are the kind of things we're still trying to learn about, because it's not like any other species on Earth. And it matters. It really does matter, because we're in so much trouble with elephants. The poaching crisis is unbelievable. And this is not like one man photoshopped. This is multiple rangers with the tusks. And each pair of those tusks is a dead elephant. We can't keep going like this. We don't have a lot of time to learn about elephants. Ivory is still bought and sold. When they talk about, an elephant's a big tusker elephant, and there are very few of them left because they've been poached. That's 200 pounds of ivory. Most elephants, if they have 100 pounds of ivory, 50 pounds of ivory, that's a big deal. So when you hear about a country, it's burning 17 tons of ivory as to make a statement, well, think about how many elephants that represents. That's a staggering number of elephants. we talk about the ivory trade. It's not just ivory, and it's ridiculously complicated. This is one of those graphs where you go, oh my gosh, I can't even look at it. But this is an organized crime. It is as complicated as banking. And this is why it's not just a bunch of little farmers who are going out and shooting the elephant who is raiding their crops. And that certainly is a problem. These are crime syndicates, and it's not just ivory. It's skin, which is being sold for Chinese medicine. It's boot leather. I regularly lecture in Central and South America, and I have yet to go into a fancy shoe store and not see leather jackets, elephant leather boots, elephant leather shoes. And when you ask them, it's African elephants, you ask them, where did this come from? They go, oh, it's from a cull. Well, you know what? There hasn't been a cull in 20 years. This is part of the ivory smuggling, and this is not sustainable. In Africa, it's still used for bushmeat. In Asia, human-elephant conflict, something like 70 elephants a year are run over by trains. This is a train death, electrocutions, hit by cars. The numbers are unbelievable. We also have another problem, and this is one of the things I deal with regularly, is it's a disease that we only recognized about 20 years ago. It is a disease that affects young elephants, our little ones, our 2 to 6 year olds, and it causes massive internal hemorrhage in a 24 to 48 hour period. And this is what the body parts look like. I mean, it's just horrible, and it's like an Ebola. What it actually is a herpes virus, and we've identified that herpes virus, but it has caused the death of 50% of the babies born in North America in the past 20 years. It's caused 60% of the babies born in Europe. And we've now been able to test in the range countries, and it's most affecting Asian elephants. So that's where we've done most of our research. But we've found that in wild elephants, now that the forest rangers are going out and doing these autopsies, it's killing them too. It is a disease with 60 to 80% mortality. And to put that in perspective, well, the flu of 1918 that killed, I think it was 25 million people worldwide, that's 2.5% mortality. 60 to 80% mortality is like, it's just one step below rabies. It's actually at the level of Ebola. And just this, in 2019, for the first time, I dealt with my first cases of this horrible hemorrhagic disease in young African elephants that were born in the United States. And that's not, we have some countries, this is Sumatra, which is still capturing the few wild elephants they have. There's a 90% mortality with the capture, but they can use these as bribes for local officials. They can bring them to temples and pray for better times. Several Asian countries, not Southeast Asian countries, will buy one of these elephants that survives for $10,000. And Sumatra is a horribly impoverished country, and $10,000 is a lot of money. We are disrupting their social structures. They're not living in normal groups anymore. And young elephants who learn from the matriarchs, they learn from their siblings, they're not getting that training anymore. Sumatra and lots of places, Africa, India, are doing slash and burn forests, so they're losing habitat, and that increases the amount of conflict they come into with humans in the area. And this is a map that shows the dark brown are areas where Asian elephants were abundant in 1930. The green that says present range, that's where they were in 1980. And this is, these darker areas is all that is left of elephant Asian populations now. This is the African elephants. This is what we have left. But all of those areas that are surrounded by purple were filled with elephants at the turn of the century. So the losses are unbelievable. and they're not sustainable. They also don't seem to be decreasing, which is horrible. And right now with COVID, in fact, we're finding that the poachers are realizing that, you know, there's not as many people around, and we're going after them. This is horrific. We have gone from having 100,000 wild elephants in Asia in about 1935 to 45,000, but the rate of decrease is also unbelievable. Vietnam had 2,000 elephants in 1980. Actually 70 elephants is what they had in 2010. And the latest news I heard from Vietnam is we're down to 20. And that's because Vietnamese ivory is supposed to be super special. I think elephants are super special. But this is a problem. There are countries where we can't survey. Laos, for example, and I've been to Laos, it is an area where we can't survey the elephant population because there's still so many unexploded mines. You can't go into elephant areas, but those mines are killing elephants who step on them. And China keeps buying elephants. And so that's where a lot of those $10,000 elephants are going. They're going to China. The problem isn't really good in human care either. And zoos and facilities that host elephants think they are an ark, you know, they're saving the last elephants. They're gonna breed the elephants when they go extinct in the wild. And by the way, there's not a lot of wild when you have all that habitat loss. We only in North America have 209 elephants of each species. That's not a lot. We are not allowed to import Asian elephants because of CITES rules, which control endangered species. There have been some importations of elephants, but they're all super closely related because the only country we can import from legally is Swaziland. So we're getting related groups. And that means that we're not really getting a good gene, you know, we're not getting a lot of options with the gene pool. The captive population is aging. Okay, so the elephants we have in zoos are aging and they're starting to die, and they're dying at about 1.5 to 2% per year. And if we just wanted to maintain those numbers, we'd need somewhere between 8 and 14 babies born each year of each species. We're getting 2 to 4 each year. This is not sustainable. And on top of that, the babies that are being born are dying of EEHV, that awful herpes virus I mentioned. We have very few facilities that have bulls because they're so big and they're dangerous and they require lots of specialty, lots of special knowledge and lots of special facilities. And, you know, to get breeding, you kind of need a boy and a girl. The only artificial technologies we can do, we can do artificial insemination, but it's very, very uncommon. I didn't get to mention that elephants have a unique reproductive cycle. That shouldn't surprise you after everything else I've said, where they only cycle 4 times a year. And they have these bizarre cycles with all these weird hormones going back and forth, unlike any other species. So trying to do artificial insemination is like the sun, the moon, the stars have to align for it to work. And also usually when you do an AI and it does work, you get a bull, which none of the zoos want to have. So, you know, this is not the way to do it. So we're not even having animals breeding right now. And we also know that matriarchs teach. They teach mamas how to be good mamas, and we don't have normal herds here. We'll have like a zoo with 4 elephants and they're not related and none of them have ever bred, so they don't even really understand it. And then we have a high calf mortality for a lot of different reasons.
Good night, Nancy.
So, you know, then you'd think, okay, our management out there is going to be saving us, but you know, the AZA, which is the oversight organization for most zoos in North America, just got friendly with the Humane Society of the United States, whose stated goal is to close all zoos. And here's the head of the HSUS shaking hands with the head of the AZA, and you go, huh? Which is what all of us who work for zoos did. But it does make you realize that when the very organization that supposedly is supporting you is working with the enemy, the people who want to shut you down, these are the animal activists who protest everything, it kind of doesn't bode well for the future. So the big picture problems is the poaching epidemic, the loss of habitat, we got disease, and we can't seem to breed elephants. And that means when you do the math that elephants may be gone in our lifetime from the planet. Yeah, it's depressing. That's not the way to end a talk, is it? So we'll move on from that, and I'm going to show you some cute pictures of my favorite little elephants in zoos. These are just short videos. These are facilities that I've worked with that are successfully breeding elephants. And I also think a lot of people have this very odd idea of that elephants are suffering in zoos. And I can tell you, these are, well, I'll let you make up your own mind. I won't say anything. So this is Hannah and Lily, and Mom is getting a bath. She is asked to lie down, and elephants like water, and they like, you know, getting cleaned off. And Hannah, who's the little one, likes being a pain in the neck. And I have like hours of movies of her throwing the hose around and jumping on her mom. This was great fun for her. This is, that was very cute. Hold on a sec. Okay, this is Baylor and Tupelo, and this is the Houston Zoo. And my friend Daryl is the head of this group of elephants. They have one of the most successful breeding programs. And I said, how long do those swimming pools last? Oh wait, here comes a big moment. Yay, she fell in. And he says they usually last about 3 baths, and then they explode. And the elephants kind of enjoy that as much as possible, but they have a big budget set aside for elephant bathtubs. So, you know, the question is, and I don't want to leave you with a, oh my God, it's horrible. I think the question is, what can we do about it? You know, if you're not taking care of elephants, what can you do knowing that elephants are in trouble? And I think the first thing to do is to recognize that elephant issues are really complex. And the internet often doesn't describe the complexity. It often is very one-sided. For example, right now, there's lots of travel advisories. Don't ride elephants. I don't agree with that. I've been to most of the Southeast Asian countries, and there are bad elephant camps that you don't want to go to. They're actually not the ones usually run by the people in that country. They're outsiders. They're Westerners, or they're from China, or they're just, you know, they're just not from the area. Countries that have elephants they adore their elephants. This is part of their culture and their history, and sometimes their religion. And really good elephant camps, it's a privilege to be around the elephants, and that's how their elephants, who have been in domesticity with them for 3,000 years, the only other animal that's been with people as long as that are camels. You know, they're part of the family. They sleep in the family's home, and they're beautifully taken care of. And the elephant rides, and elephants are not, you know, at 9,000 pounds to 14,000 pounds, an Asian elephant is not troubled by a 200-pound person sitting on their back. And that ride pays for their food. So the mahout is doing something that is a noble, honored profession. And you, by riding that elephant, are helping to take care of that elephant. And so it's not, don't go to camps, don't ride elephants. It's go to good camps and support elephants and support the mahouts who are trying to keep the elephants fed and cared for. And the really good camps provide everything from education for the mahouts' children, and medical care and health insurance. And that's what you want to support. But when you go to the internet, it's like, don't ride elephants. And you know what? You don't support those elephants, they're not going to eat dinner. Be aware that a lot of the animal rights groups, HSUS and PETA, are not interested in animal welfare. Animal rights is not the same as animal welfare. Animal rights actually believes things like you shouldn't spay or neuter your dog because your dog isn't asking to be neutered. They don't believe in vaccines. They actually believe that an animal should be dead than in human care. So they want to shut down zoos, and they don't care what happens to the elephants. So be aware that if you're looking at animal rights sites, you're going to get a very, very one-sided view that, to my mind, is awful. I mean, I would never think better dead than in human care. You know, my goal is to make them live long and happy lives. Be aware that sanctuaries, you know, just like zoos, there are good zoos and bad zoos, and there's good sanctuaries and bad sanctuaries. But what I'm finding is that the loudest sanctuaries seem to have, you know, the less good sanctuaries seem to have the best PR agents, you know, the fanciest web pages and the loudest PR, and they're not the ones that I really think should be listened to. Who should you get your information from? People who take care of elephants. Elephant keepers at your local zoos. They love to talk about elephants. I'm so happy you guys came to listen to me. I take care of elephants all the time. I mean, even during COVID, where I can't travel a lot, you know, not a day goes by where I'm not on the phone with somebody or doing a Zoom call into their elephant barn so I can see what the elephant's doing. Talk to people who take care of the elephants, and you'll find out. And if you go to places like Africa or Southeast Asia, you know, go to the experts, go to the facilities that, you know, that are part of the culture. In Thailand, there's the TECC up by Chiang Mai. That's where the royal elephants are. That's a wonderful facility. Talk to members of accredited organizations. And if you want to talk to those individuals, or if you want to support them, you know, go to the elephant organizations where the money goes to the elephants. The ones that I like, and I don't have any ties to them other than myself being a supporter. I don't work for them. Our International Elephant Foundation, and if you do want to take a picture of this, you can. Or the Elephant Managers Association. The IEF, the top one, they support all sorts of elephant projects in the range countries, both Africa and Asia, and the money, you can even specify where you want the money to go. They are a great group, and they, you know, get regular reports. They also support a lot of the research on herpes virus. And the Elephant Managers Association is a really neat organization that promotes education. And they have a very fun meeting every year, except this year, of course, where they get everyone from elephant vets, I often lecture, they get elephant keepers, they get anti-poaching units from Africa, and biologists and elephant historians, and once in a while just people who like elephants and get up and show bizarre, you know, slideshows of, you know, elephant statuary from France, you know, things like this that you go, what? But it's fascinating. It's like 2.5 days of all elephants all the time. And they provide scholarships for people to take classes. They have classes for mahouts in range countries to learn how to do foot care and promote good elephant care. So, you know, there are other ones out there, but there are an awful lot of elephant organizations where you give money and maybe 1% of it gets to elephants. And I suppose that's true of a lot of charitable organizations, but elephants touch us, and they touch our heart, and we want to support them. And sometimes we don't do the research to know where the money should go.
Ellen, we have 2 questions in the chat.
I am all done. So we can take questions now. This is my final photo, and these are 3 elephants that I take care of in Texas, and I just came back from seeing them. And okay, after this talk, do you guys know what kind of elephants these are? Are they African elephants or Asian elephants? That's your quiz, your big quiz.
Well, they look huge compared to you, but I know that you're not big.
They are huge. They're African elephants.
Oh, they're African.
They're African elephants, and African elephants, both the girls and the boys have tusks. And Asian elephants, only the boys have tusks. And these are girls, and yes, they look huge, but you should see the boys. Oh my God, that's huge.
They don't play.
All right, I'm happy to answer questions.
So if you look in the chat, there are two questions. One,
Wait, how do I get to the chat? Hold on a second,
at the
folks.
bottom of the screen, just
Oh,
click
that
on
wasn't-
chat.
Bottom of this, I don't have a bottom of the screen.
So I'll read it to you. The first
Okay.
one is, what makes the Houston breeding program successful?
That is a great question. So there's a couple of things. First of all, they have bulls. That sounds insane, but there are a lot of facilities that are actually trying to breed without having bulls on property. They're trying to do artificial insemination, which means they have to, very few bulls in the United States are producing decent semen, and there are a whole bunch of medical reasons for that. So first of all, they have to find a bull that's producing decent semen, and he has to be collected, which, as you can imagine, in an elephant is not a simple procedure. It's not like you go into the bathroom with the elephant pornography magazine and get some semen back. It's a whole big thing. And then the elephant semen has to ship to wherever the female, who hopefully, her cycle is lasting 6 hours, and you get it in. And then if you want to actually get the semen into the elephant, you need a 9-foot-long endoscope, and you need me sitting underneath the elephant, which is really not my favorite place to sit. And it's still kind of magic because I didn't even go into this. Elephants have 3 holes. First of all, you have to go up a 6-foot-long birth canal to 3 holes, 2 of which are blind ends, and only 1 of which is a cervix, before you can deposit that semen. And people wonder why artificial insemination doesn't go very well. That's just awful. So Houston's program actually has 3 bulls. 1 is too young to breed right now, but the other 2 are breeding. It has a very big herd. So it has matriarchs, many of whom have had many calves. And so they know how to kind of teach the younger kids. They have a whole bunch of little elephants right now playing with each other. And
Hey, can I interrupt a minute?
Sure.
How much land is there?
Actually, I can't give you the numbers, but the thing about Houston is that they sit on a huge city park, and the city has given more and more land to the elephants. But since you brought that up, one of the great falsehoods about elephants is they need massive amounts of land. Again, if you go to the internet, they'll tell you elephants need to walk 10 to 20 miles every day. Well, that is not true. The only elephants in the entire world who do that are this small group of African elephants living at the edge of the Namibian desert in a drought. They walk 10 to 20 miles a day because they will starve to death and die of thirst just to get to water. Most other wild elephants move a maximum of 3 to 5 miles a day. That's a maximum, and when they're babies with them, they don't go much of anywhere. In fact, that's one of the problems in zoos is, the zoos keep giving bigger and bigger spaces, but since the elephants are provided with the stuff, they often don't want to move around. That's why so many zoos now have exercise programs, because elephants tend to be kind of like us. They don't really want to exercise, but they don't need a lot of space. And that's, and the Houston Zoo actually has a lot of space. The city keeps giving more to them. But they have a big herd. I think they have 12 or 13 elephants at this point.
Okay, the next question was, can you refer us to a good reference for elephant anatomy and physiology? This is fascinating.
I could, if you're going to post some stuff up here, Rachel, like my talk, a recording, could I post some things for people to see? Because there really isn't something, short of buying a $120 elephant textbook, which I don't think anybody, even I don't want to buy a $120 textbook. I'm happy to post some stuff, like some slides. Could I do that, Rachel?
Sure.
I'll email them to you, and you can put, you can look at them. Yeah.
So
I agree. It's fascinating.
In a couple days on our website. Okay, so the next question is regarding teeth. Are they sloughed off, out, and are they born with a whole complement of teeth?
Yes, they are. And I have an x-ray of a baby elephant. That's the only size elephant I can actually x-ray the head, because they're too big after they're more than a week old. And you can see all the little tiny teeth. And yeah, they slough off, and the elephant's teeth, they come out. Hold on one second.
Because who doesn't have some elephant teeth that they keep in their home?
Here's an advantage of giving a lecture from home. This is a cast of an elephant's molar. So the keeper found it on the ground. It just came out. And sometimes they're a little uncomfortable as the tooth is moving. So very often you'll see elephants chewing on really huge logs, or it looks like they have a cigar coming out of their mouth, which is a huge log. And they're kind of just trying to help the tooth move along. But this thing weighs, this is just a piece of one. But what you can see is all of these are different segments of teeth, and they're cemented together by a compound that's actually called cementum that the elephant's cells in its mouth produce, and they join together. And so once they're all joined together into this massive block, they do their job as molars, crunching things, and then they just keep moving forward in the mouth until they come out. And this is the bottom of the tooth. This is the side that would sit in the elephant's tooth's mouth, and it's just really kind of remarkable.
All right, so the next question is curious about their behavior, legendary memories, how they gather when an elephant is in trouble or dies, the attentive care of mothers for their babies.
So I guess the big thing is that elephants are individuals. And that's what's so cool about them. This animal is so intelligent. It makes dolphins look like, dummies. There is nothing smarter than an elephant. Having said that, there are some dopey elephants that I've met. There are some elephants that elephants, they have these very distinct personalities. There's funny elephants, there are mean elephants, there are angry elephants, there are happy elephants. There are elephants that are really interested in learning, and elephants that are very smart but just want to make trouble. It's kind of remarkable. But their brain is massive. It is absolutely incredible. They also, there are bad mothers too, but in a normal elephant herd, there would be other animals to help take care. And we very often see aunties. Good programs we call them aunties or grannies. The fancy scientific term is an allo mother. And you'll very often, and it's good because these little elephants get so obnoxious. They're born weighing somewhere between 200 to 400 pounds. And they're very precocious, and they're up and running around and yelling within usually about an hour of birth. And one of the things they do, and I have not had my own children, but I've seen many moms with kids, the baby keeps yelling and being obnoxious. Well, imagine now you have a 600-pound infant who is jumping on your head and yelling, and you're trying to take a nap because you haven't gotten any sleep. It's just terrible. Well, those allo mothers and those aunties will deal with the baby, and they'll push her aside so mom can get a little rest. And that's one of the reasons I also suspect that, zoos are struggling, is because they don't have these normal herds. They can't. They're just a little collection of elephants from here, there. And a lot of zoos are trying to have bigger herds, but they're still not a normal herd, because a normal herd would be related to each other. And that was a very long, complicated question, Rachel. I can't remember what else they asked.
Why don't we move on to the next one? I think that answered a fair bit of it. Were you involved with the findings of the 350 elephants that died unexpectedly in Botswana? I heard it was bacteria in water, maybe related to global warming.
Well, yeah. So what they died of was cyanobacterium. That's blue-green algae, and that blue-green algae grows in water that's inappropriately warm or not filtrated. In Africa, very often areas that have a lot of hippos, because of all the poop that hippos produce, That poop, and the hippos, it makes the water very murky and cloudy, and you get a lot of cyanobacterium, and it's a deadly, deadly liver toxin if you swim in that water. But we have cyanobacterium here, and it is related to global warming. I worked at a facility on the West Coast, a beautiful wildlife facility where, the deer, a lot of the hoofstock was free roam, and you drove through in a little safari bus, and there were ponds all over. And all of a sudden we had like these weird blue-green splotches, and we had to figure out how to keep the animals out of that because, we had bizarrely warm areas, off the Pacific Northwest coast. So yeah, cyanobacterium is what they found killed those animals. It's absolutely deadly. It's not unique to Africa. We have that here, and it is related to global warming, and we do not have antidotes for it. It's also a very rapid death. It causes acute liver failure to any species that encounters it.
All right, so the last question is, are you treating elephants for the atherosclerosis, and how do elephants develop the disease?
It's a great question. We often don't know that they have atherosclerosis until we find it at death, at autopsy. The wild elephants, a whole bunch of different thoughts have been brought up about why they have atherosclerosis. We think of atherosclerosis in humans as being related to diet and genetics. Elephants are eating grass. They're herbivores. They eat grass and trees and browse and flowers. So they're not eating the kind of things. So genetics has some part of it, but one of the really interesting things is that disturbance to the heart, things that make the heart move, can lead to, I guess the best way to describe it, or my understanding of it, I'm not a cardiologist, is it can kind of churn stuff up, and it can create areas of deposit that atherosclerotic lesions, which basically are lipids or fats, can stick to. So the explanation is that because the heart is so massive in elephants and the blood flow is so dramatic, and there's like waves inside the heart, and you looked at that 45-pound heart, it may be setting up sort of microcurrents where the lipids in the fruits or the vegetables they eat. I don't know. I don't have a good explanation for that. And it is hard to study a heart. We can't listen with a stethoscope. They're so big that I can't do an echo. The things I do to figure out an elephant has a bad heart is I do an EKG on them. I can feel pulses on arteries on the ears on some elephants, depending on how thick the skin is. So I try and get a pulse quality. Very often you'll get a history from a caretaker, a keeper, a vet. She usually likes to run around, but she's just sort of hanging out. She's tired. I can do pulse oximetry, which are, how much oxygenation is getting through. But we often are just guessing. And so at this point, to be perfectly honest, we are not treating atherosclerotic lesions. And one of the good things is in the past 10 years, we are feeding elephants in human care a lot better. We're not giving them, we're trying to give them a much more natural diet of grass and browse and bushes and vines rather than the pellets that, zoos like to buy so much. But since we know that the wild elephants get it, I'm going to guess that genetics has something to do with it too, just like in us.
Okay, last question. What's your take on circus elephants and animals?
Okay, we didn't tell you the big secret about me, and I often don't tell people because until they get to know me a little bit. I was the director of veterinary care for Ringling Brothers Barnum and Bailey Circus, and that's where I took care of my 60 Asian elephants. And I was, it was a wonderful experience. I miss it very much. I think the thing to remember about elephants in human care, circuses, zoos, sanctuaries, is there's good and there's bad. Just like there's good pet owners and there's bad pet owners. Good elephant camps and bad elephant camps. Where I was, the facility, they had most of their elephants were actually not circus elephants. They were doing breeding and running around an enormous property in Florida. Very, very successful program. While I was there, I delivered 19 baby elephants. It was cradle to grave care. There were, multiple veterinarians caring for them. And the only elephants that went on the road were elephants that were super social and super interested in it. I used to try when I was the director, I try and retire the older ladies because, just like us, old age is not necessarily kind to everybody. Not everybody looks like Christy Brinkley at 60. And so some elephants kind of saggy and baggy and they get lumpy and bumpy. And I try and send them home to this beautiful place in Florida, and they didn't want to leave their friends. They would sit in this, 10-acre paddock and just be miserable. And so, there were elephants who absolutely enjoyed it. And that's the right way to do it. I think those elephants were beautifully cared for. There were, 4 boarded veterinarians. I had an unlimited veterinary budget, which I've never had in my entire life. And there are also bad circuses. I've seen that too. So again, I think the paintbrush that is being used with elephants, and it's a very confusing and very complex situation. And, if you're concerned about it, go and see. I used to regularly bring people backstage to see the elephants. Actually, Rachel's sister, Amanda, and her family used to come and see my elephants. And I remember them hanging out with me in Florida one year. And, I've always been happy to show people what I'm doing. I've often thought I should set up bleachers when I do procedures on elephants. Everybody wants to see, and I'm really happy to have them see it. It is impressive to be up by elephants. And there are even facilities, like if you want to see what a good elephant person does, I'm glad to send you to places where you can see that firsthand. And I don't want to send you to the bad places, but you'll recognize it right away. And elephants have relationships with the people who take care of them. And you may not know anything about elephants, but you can see that relationship. So that's my feeling. There's good and there's bad, and you decide on an individual basis.
All right. Well, thank you. I think we are going to wrap it up because we have gone for a long time.
Oh, I'm so sorry. Oh my God, we went so long.
I know, but everyone's totally enjoyed it. It wouldn't have gone this long if people weren't interested in having all these fabulous questions.
I thank you so much for inviting me, and thank you for listening, and I will get some stuff to you to post, and be safe and go visit your elephants.